Begin the assessment by observing the patient's head, visually looking for symmetry and patterns of hair growth and expression. Palpate the head for lesions and lumps, also observing for any nits. Move your hands then to the temporal artery to assess the temporal pulse, and then move your hand down to the jaw to assess for TMJ by having the patient open and close their mouth. Then begin to palpate the pre-auricular and post-auricular nodes, moving then to the occipital nodes. Also assessing down the posterior cervical chain and anterior cervical nodes. Move then into the submandibular, sublingual, and submental nodes. We then ask the patient to lean their head forward and check the subclavicular nodes. Have the patients shrug their shoulders to check the cranial nerve 9. Next, move onto the trachea and make sure that it is midline using the lead marks of the thyroid cartilage, the ring of cricoid cartilage, which is below the isthmus. Have the patient swallow to check for movement. Next, inspect the thyroid by observing for size, shape, and symmetry. The carotid artery will then be palpated, and once you palpate it, then you need to use the bell of your stethoscope to listen to the artery. You assess this on both sides of the patient. The mouth is the next area of the assessment. You begin to inspect the patient's lips, buccal mucosa, gums, hard and soft palates, the floor of the mouth for color, surface, and characteristics. Have the patient move their tongue. It's optimal to use a tongue depressor during this procedure. Inspect the oropharynx, noting the uvula, tonsils, posterior pharynx, odor, and gag reflex. Next, inspect the nose. You want to have the patient cover one side of their nose and breathe, and the other side and breathe to check for patency. Using the otoscope, inspect the patient's internal nares by leaning their head back to see for better viewing. Then move to the ears. You inspect the patient's ears, the auricles, you're going to palpate them and make sure that everything, the surrounding tissue is intact, noting the alignment and placement. Perform the otoscopic exam, inspecting the canals, tympanic membranes for landmarks and deformities and inflammation, noting the tympanic membrane, assessing its color, and also the patency. Next, assess the hearing with the whisper test. Have the patient cover one ear, whisper, and see if the patient can hear and repeat it on the other side. Next is the performance of the Weber test and then the Rhine test. This is performed on both ears. Next, inspect the patient's eyes. You begin by dialing in with your short focal lens to examine the cornea and the iris. Once you've examined both eyes, once you've dialed in and found your number, you then assess the patient's eyes. Once that assessment is performed, you then dial in with your long focal lens and you repeat the same assessment on each eye. The short focal lens is used to examine the cornea and the iris, and then the long focal lens is used to examine the retina, making sure to dim the light on this exam. If the patient complains of any blurred vision or vision difficulties, it would be necessary then to move on to the Snellen chart for a visual exam. Also assess the patient's eyes, eyelids, eyebrows, eyelashes, noting alignment of the brows and movement. Inspect the orbits and then assess the peripheral visual fields. Check this by checking the H pattern and then move your finger into their nose.